Correcting chronic nasal obstruction can improve sleep quality, reduce severity of obstructive sleep apnea, and increase CPAP tolerance. I'm Dr. Jordan Weiner, an ear, nose, and throat doctor in Scottsdale, Arizona, specializing in the treatment of obstructive sleep apnea and related conditions affecting sleep quality. When airflow through the nose is blocked or restricted during sleep, the tissues of the throat collapse more easily. The lower jaw moves down and the tongue moves back in the throat. This reduces airflow through the throat even more. People who cannot breathe through their nose may have poorer sleep quality and more daytime sleepiness, even if they don't have sleep apnea. Studies have shown that correcting nasal obstruction improves sleep quality, sleepiness scores, and snoring. In people with obstructive sleep apnea, correcting nasal obstruction can reduce the number of apneas per hour of sleep by 3 or 4. This is not enough to treat their sleep apnea, but restoring nasal breathing can improve CPAP tolerance. In most cases, people can switch from a face mask to a nasal mask or nasal pillows. Correction of nasal obstruction also enhances the effectiveness of other treatments, like oral appliances or surgical procedures. It can improve the success of hypoglossal nerve stimulators like Inspire and Genio by helping the tongue stay in its normal location in the front of the mouth rather than slipping backwards due to an open mouth. Many conditions can cause chronic nasal obstruction. Allergies, chronic sinusitis, and autoimmune disease cause swelling of the lining of the nose, restricting airflow. These conditions are treated with medications and topical treatments. Nasal polyps, a crooked nasal septum known as a deviated septum, enlarged turbinates, tumors, and enlarged adenoids can also cause nasal obstruction and may require surgery to restore normal nasal breathing. If you cannot breathe through your nose because of septal deviation or enlarged turbinates, you may be a candidate for septoplasty and/or turbinate reduction. Before considering surgery, it is important to treat allergies and other conditions that may worsen nasal obstruction. A 2-month trial using daily nasal steroid spray may improve nasal breathing in some people and is usually recommended before surgery is considered. If that does not improve symptoms enough, surgery to restore nasal airflow is recommended. Septoplasty is a surgical procedure that straightens the deviated portions of the septum to restore adequate airflow. The septum is a wall of bone and cartilage that divides the nose into 2 passages. Septoplasty is performed under general anesthesia in an outpatient surgery center. The operation is performed through a small incision inside the nose, leaving no visible scar. Through that incision, the septal cartilage and bone are repositioned and placed back in the middle. Limited trimming of cartilage and bone may also be required. The nasal passages are thoroughly washed out and flexible splints are placed in both nasal passages. A temporary suture is placed to hold the splints in place. The splints are needed to prevent any movement of the septum after it has been straightened. I do not place packing in the nose so that some breathing through the nose is possible even with the splints in place. Most patients go home the same day of surgery. Exercise and heavy lifting should be avoided for 2 weeks after surgery. During the first week after surgery, facial pain is generally mild to moderate. Bloody nasal drainage, nasal congestion, and stuffiness are common in the first week after surgery. Sleeping with your head elevated can reduce swelling and pressure. Flushing your nose with saline solution beginning the day after surgery helps to remove any dried blood and mucus to reduce scarring. This should be performed several times a day. Many patients can return to desk work during this week if they feel up to it. The splints are removed at the end of the first week. Once the splints have been removed, nasal breathing is usually excellent immediately. Residual swelling and congestion generally resolve over the next 2 to 4 weeks. Complete healing takes a few months. As internal swelling fully resolves, nasal breathing improves. Septoplasty is generally safe, but like any surgery, there are risks. These include bleeding and infection. A fluid collection in the septum called a septal hematoma can form and require drainage. There can be a perforation of the septum. Most perforations result in no symptoms and don't require further interventions. Persistent nasal obstruction can occur if the deviation wasn't fully corrected or recurs. Change in the appearance of the nose can rarely occur. Published studies reveal success rates of about 75% in improving nasal airflow obstruction. Reducing the size of large turbinates is another way we improve nasal breathing. Along the side wall of each side of the nose, there are 3 bony, curled protrusions called turbinates. Turbinate reduction makes enlarged turbinates smaller to open your nasal passages. The goal is to make sure you have enough airflow through your nose to breathe comfortably while still preserving the function of the turbinates. Radiofrequency turbinate reduction uses gentle heat to shrink the turbinates. It can be done in the office with local anesthesia and takes about 15 minutes to perform. A thin probe is inserted under the surface of the turbinate. It sends energy into the soft tissue, causing it to heat up, which then causes shrinkage of tissue and scar tissue formation within the turbinate. Over several weeks, the treated area becomes smaller. The size of the turbinate can also be reduced by going under the soft tissue and gently trimming the turbinate. Most people find recovery from turbinate reduction easier than they expected, though it can vary depending on the technique used. In the first few days, there will be nasal congestion due to swelling and crusting. Breathing may feel worse before it improves. Expect some bloody nasal drainage, facial pressure, and mild discomfort. Sleeping with your head elevated and using saline rinses can help with the discomfort and reduce crusting. Swelling peaks around days 3 to 4 and then gradually improves. You can usually return to desk work immediately, though you'll need to avoid strenuous activity and heavy lifting for 2 weeks. Over the next 2 to 4 weeks, there may still be some nasal crusting and drainage as your nose heals. Using saline rinses and antibiotic ointment regularly keeps the nasal passages clear. Complete healing requires 6 to 12 weeks. During this time, turbinate tissue settles into its reduced size and swelling fully resolves. Research shows success rates ranging from 75 to 95% for reducing nasal obstruction symptoms. Improvement from turbinate reduction typically lasts for years. Turbinates can be enlarged over time, particularly if underlying allergies or inflammation aren't well controlled. Maintaining results often requires ongoing medical management of allergies and environmental triggers. Turbinate reduction is usually safe. Like any surgery, there are risks. These include excessive bleeding requiring intervention, infection, scar tissue in the nasal passages, persistent dryness or crusting, and turbinate regrowth requiring additional treatment. Temporary changes in smell or taste may also occur. The most serious possible complication is empty nose syndrome. This rare condition happens when too much turbinate tissue is removed, usually as a result of the turbinate being resected rather than simply made smaller. This condition makes it hard to breathe and causes severe dryness, even though the nasal passages are open. This complication is avoided by leaving enough turbinate tissue in place. Turbinoplasty changes the position of the turbinate. The turbinate bone is moved outward to make more space in your airway. This method is often combined with radiofrequency ablation. Chronic mouth breathing from nasal congestion can worsen sleep quality and make treatments for sleep apnea less effective. Treating the cause of your congestion is an important part of sleep apnea management. If symptoms do not improve with medical therapy, surgery may be indicated. Septoplasty and turbinate reduction are procedures that can open the nasal passages to restore nasal breathing. For more information about nasal obstruction and my practice, please visit weinersleepsurgery.com.